What's up, Microbiology Nerd Squad? Welcome to episode 4. Today we'll be diving deep, literally, into the lungs to talk about lower respiratory tract infections. We'll explore what they are, how they're caused, their symptoms, and since I'm a scientist, I'll let you guys in on how we diagnose and treat them in the lab. Without further ado, let's begin. First, let's take a tour of the lower respiratory tract. This system includes the trachea, commonly known as the windpipe, which branches into the bronchi. These bronchi further divide into smaller airways called bronchioles, which ultimately connect to the air sac structures known as alveoli. The body acquires fresh oxygen and removes carbon dioxide via the respiratory tract. This gas exchange occurs in the alveoli. To help remember this, picture the respiratory tract as an upside down tree. The trunk represents the trachea, the branches symbolize the bronchi and bronchioles, and the leaves correspond to the alveoli. Now, the key part to focus on are leaves. Remember the word photosynthesis from biology class? It's the process where leaves take in carbon dioxide and release oxygen. Now, think of the opposite. This is what our lungs do. They take in oxygen and release carbon dioxide. So, what exactly are lower respiratory tract infections? LRTIs are infections that occur in the parts of the respiratory system we've just discussed. The most common types of lower respiratory tract infections include bronchitis, bronchiolitis, and pneumonia. Other lower respiratory tract infections include tuberculosis, primarily affecting the lungs. To help remember this, I connect the infections with the specific locations in the respiratory tract. Bronchitis, for instance, affects the bronchi. A quick tip for you guys. Words ending in itis indicate inflammation. So what do you guys reckon bronchiolitis means? You got it, inflammation of the bronchioles. So, what causes lower respiratory tract infections? They are typically caused by various pathogens such as bacteria, viruses, and fungi. These pathogens enter the respiratory tract through inhalation, aspiration, and close contact, leading to infection and inflammation of the lower airways and lung tissue. A quick tip to remember the word aspiration. Think of the first letter A as in apple, which represents food. Aspiration means inhaling substances like food or liquid into the lungs. This connection can help you recall the term and its significance in respiratory health. Ever wake up on a Monday morning feeling like a bus ran over you? Yeah, me too. Coupled with symptoms such as chest pain, persistent cough, wheezing, shortness of breath, fever and chills, fatigue, loss of appetite, and increased mucus production. We're talking lower respiratory tract infection. Not pleasant. Did you know lower respiratory tract infections are one of the leading causes of morbidity and mortality worldwide? It's responsible for approximately 3 million deaths annually. It makes you think, how can something so tiny cause so much trouble? Let's dig deeper. Let's get specific about the common pathogens that cause lower respiratory tract infection, shall we? They're all competing for the title of most unwanted, with some causing more severe infections than others. Some of the common culprits include strep pneumoniae, known for causing bacterial pneumonia, characterized by high fever and productive cough, Haemophilus influenza, causing pneumonia and bronchitis, especially in individuals with underlying conditions like COPD, Mycoplasma pneumoniae, causing walking pneumonia, often with milder symptoms but persistent cough. It's tiny and lacks a cell wall, making it very tricky to treat. Influenza virus leads to viral pneumonia, particularly severe in elderly and immunocompromised. Respiratory syncytial virus, RSV, a major cause of bronchiolitis and pneumonia in infants and the elderly. Aspergillus, a fungus that can cause severe infections in immunocompromised patients. These pathogens enter the lungs often following a weakened immune system or, in some cases, an upper respiratory tract infection. Did you know a single sneeze can release up to 40,000 droplets into the air, each potentially carrying germs? It's like a mini fireworks display of microbes. It's time to see how the scientists in the lab figure out how to diagnose lower respiratory tract infections. It all starts with sample collection. Samples collected for lower respiratory tract infections include sputum, bronchial alveolar lavage, and endotracheal tube aspirates. Sputum is easy to collect and non-invasive, but requires the patient to be able to produce it. Patients who are intubated cannot produce sputum and therefore require ETT aspirates for sample collection. Bowels are particularly useful for diagnosing infections deep within the lungs, such as pneumonia or suspected lung abscess. The choice of sample depends on clinical factors and the patient's ability to produce samples. So, what comes next for these samples once they reach the lab? After booking samples onto the system, we gather all the necessary culture media for the sample type and inoculate the samples in a safety cabinet. Whilst manipulating respiratory samples, we work in a containment level 3 area that operates under negative pressure. This allows for samples that potentially contain hazard group 3 organisms to be contained whilst manipulation and protects us. A gram stain may be performed on certain sample types such as bowels, but this is not always necessary for all respiratory samples. Sputum samples can often be contaminated with saliva, which harbors various malflora. A gram stain can complicate the interpretation. It's also not specific enough to detect pathogens such as Mycoplasma pneumoniae and viruses, which lack the cellular structures that the stain targets. Auramine and ZN staining can be used to stain acid-fast bacilli found in respiratory samples. Respiratory samples are often inoculated onto the following plates: blood agar used to grow a variety of bacteria, blood agar incubated anaerobically for bacteria that grow without oxygen, chocolate agar for fastidious organisms that require enriched media, McConkey agar selected for gram-negative bacteria, sabroid agar for fungal culture, and selective media such as Pseudomonas or Burkholderia agar, usually for cystic fibrosis patients. The inoculated plates are incubated at different temperatures under various conditions. Plates are then read between 18 to 24 hours of initial incubation and again at 48 hours. Some plates, like sabroid agar, can require up to 5 days of incubation because fungi like to take their time. Now, say you're experiencing upper respiratory tract symptoms that progress into lower respiratory tract symptoms like coughing and wheezing, but nothing grows on the culture plates. Does that mean you're fine? Unfortunately, not. Culture plates only grow bacteria and fungi, but the good news is we can now rule out these infections. We then put your sample through other diagnostic tests such as PCR and rapid antigen testing, and voila, positive for influenza virus. Now we know who the culprit is. If the infection was bacterial or fungal, susceptibility testing would be performed to treat the infection. Speaking of treatment, let's talk options. Treatment varies based on the pathogen. Bacterial infections are treated with antibiotics like amoxicillin, azithromycin, or levofloxacin, depending on the bacteria and its sensitivity. Viral infections, mostly supportive care, but antiviral medications can be used for influenza. Fungal infections. These are treated with antifungal medications like voriconazole or amphotericin B, especially in severe cases. Remember, it's essential to complete the full course of treatment to ensure the infection is fully eradicated. Outside of the lab, the clinician may also perform a chest x-ray or CT scan in severe cases to obtain information suggesting the presence of a lower respiratory tract infection. So there you have it, folks, a comprehensive look at lower respiratory tract infections. If you enjoyed this video, hit that like button, subscribe, and let us know in the comments if you have any questions. Also, watch out for the next video on upper respiratory tract infections. Stay curious and see you in the next one.